means a couple of things. Number one, probably have your client is exhibiting tight soleus and gastroc muscle. So your client can't get optimal dorsiflexion, the toe pulling towards the shin, okay? The anterior tibialis is important because it eccentrically slows down plantar flexion. So as your client heel strikes down and goes to push off the ball of the foot, anterior tibialis is supposed to be generating force eccentrically in order to slow that down. Well, when it's not doing its job because it's shut off, because the calf complex is overactive, what happens is it puts too much load on the posterior tibialis, which is where we usually get the shin splints, okay? Another thing, posterior tibialis is usually very weak and inhibited. It's supposed to help draw up the arch of the foot and provide stability to the medial arch. But usually what we see with this as well, our clients exhibit very weak glute max and glute medius strength, okay? So here are some corrective exercises you can do. Now with the weak glute max and the weak glute medius usually comes tight psoas or hip flexors. So the first corrective strategy is going to be to inhibit that muscle with foam rolling techniques. And you can get your client on the floor with a foam roller and simply place this in the front of the hip bone, kind of the hip crest, have them roll to the side and get the hip right where it flexes. This is a great position, making sure your client keeps good kinetic chain alignment. Once you release with the foam roll, then you want to go into a static stretch, kneeling hip flexor stretch, posterior tilt to the pelvis. You can add a little rotation away to get the psoas through here, and I stretch 20 to 30 seconds. Once we release that, then we can go into releasing the calf complex with the foam roller to get the gastroc and the soleus to release, finding our tender spots, holding for 20 to 30 seconds. Great. Once we do that, then we want to teach the body now how to integrate this, activate the glutes, glute medius, and then integrate it into a movement pattern for your client to be able to keep good joint alignment and maintain the arch of the foot. First corrective strategy is going to be a hip bridge on the floor. Okay. I like using the band technique to help place around the outside of the knee to put give an extra resistance to the client's ability to activate their glutes. Feet are hip width apart, straight ahead, bellies in tight, up for 1 count, hold for 2, down for 4, 3, 2, 1, making sure the belly and the glutes are in tight. Next check. Great. Once we get the glute, we can have them roll to their side and do a basic exercise called a clamshell. The clamshell is great to work on glute medius. Okay? Great corrective exercise strategy that your client can do at home. Hips are perpendicular to the floor, about a 45-degree angle bend at the hip joint. You can keep the light band on or start without a light band. Have them bring their hip into external rotation without rotating the pelvis back. So the pelvis needs to stay perpendicular to the floor. Hold for 2 and release for 4, 3, 2. Cores engaged the whole time. Clamshells. Glute med. Once they activate that, have them hop up and do some band or tube walking. You can have the band or the tube above the knee or below the knee here, feet hip width apart, slight bend of the knee in the hip, athletic stance. Mini band walks, making sure to move through the hip and try not to rock the body at all. Mini band walks. Getting the glutes, take the band off. You want to do about 12 to 15 repetitions of those each way. Then integrate into a single leg reach pattern or a lunge pattern. Grab a